Welcome to Living Aligned. I'm your scoliosis coach, Dr. Andromeda Stevens. In this series, we'll be discussing the impact of scoliosis and the importance of a holistic approach to scoliosis treatment. We'll be discussing the importance of posture, integrating Pilates, nutrition, stress management, self-care. All of these things play a role in scoliosis care. I'm going to answer some questions, frequently asked questions, and dispelling some crazy myths that are out there about scoliosis. We hope that this series will be a positive resource for you, whether you're a parent of a child with scoliosis or if you have scoliosis yourself. I'm your scoliosis coach, Dr. Andromeda Stevens. So let me tell you how I came to this profession of mine, being a scoliosis coach. I had scoliosis as a child, and it wasn't diagnosed or cared for many, many years. I just sort of suffered with the issue and with some chronic pain until I was, in my 40s. I went to chiropractic school because chiropractic was really the only thing that helped me. I used it as a way to manage my pain for many years, and went to college and then went to massage school. And all along the way, didn't really learn much about scoliosis specifically at all. That sort of was shocking to me later in life when I did learn that there is something called the Schroth method, which is a funny word, a German name of an amazing woman who's a physical therapist. She lived in Germany. The word is pronounced Schroth, but people call it Schroth or Schroth. It is a scoliosis-specific method of treating spinal issues from any age, from babies to children to adults to older adults. It's been a fantastic change in my life. I discovered this just on a fluke. I had a patient who was having a major issue with a very large curvature and was being sent to surgery. She didn't want to do that. So we researched what she could possibly try instead. We found this Schroth method. I sent her off to do that. She came back with some information, and I said, I want in on this. Looks amazing. So I went down the rabbit hole and learned the method for myself first, and found that it was so transformative for my pain that I went all in. I got certified. I got certified again. And I've been practicing ever since. So it is my joy to work with people of all ages and help bring awareness, relief, hope to anybody who is suffering with scoliosis of any age. When I first started going to the chiropractor with my mother, just on a whim, the chiropractor discovered that I had scoliosis, and I was like, well, what is that? Am I broken? Do I have a disease? What's going on? I was just a teenager. It was quite a revelation that really freaked me out. I wish that somebody had told me, don't worry, it's this, it can look like that, and this is what it means, but I didn't really get that information. And then when I had my first x-ray in college, I was sort of shocked to actually see it. So I understand what it feels like to actually look at those images of yourself and just sort of come to, oh my goodness, okay, what do I do next? But there are resources out there for you. There are options. There is hope. There are ways to manage your scoliosis. It doesn't matter the age. It doesn't matter boy, girl. We have all kinds of amazing remedies that will help you along in your journey. So scoliosis is a curvature of the spine. The spine can bend basically sideways. It can have one curve. It can have two curves. It can have multiple curves. And those curves can really occur high up in the spine, low down in the spine. They can be different sizes of each other. But those curves also rotate kind of like a spiral staircase. And so the rotation is part of the whole concept of how you would treat scoliosis. So we have a side bend of the spine that will also rotate, usually in different directions, each curve. And then you have to also, if you haven't done this already, ask your doctor, what is happening with my spine from the front to the back? So how the outward curve of your upper back is healthy and how the lower curve of your back is healthy. Don't forget to look at your neck. So these curves all matter, what your spine looks like from the side what it looks like from the front, and what is happening with its rotations, including your shoulders and your pelvis. These things are all impacted with scoli. So how do you know you have scoliosis? How do you know your child has scoliosis? It's usually noticed just as a postural issue, like the shoulders are a little high or a little bit low, or when you lean over, you'll see, a little high side or a low side. You might see that the hips are shifted or rotated. And certainly on an x-ray, this would show up. But if you haven't had an x-ray and you're just evaluating yourself or your child, you just would look for those postural imbalances of shoulders, pelvis, and then what does the spine look like when you lean forward, like for a hamstring stretch, for example. So I've been practicing as a chiropractor for quite a while now and as a scoliosis coach for many years. And I have come across the same issues, questions, and concerns from my patients and from the parents of my patients. And I decided that in order to help people best and answer these questions, it would be a great idea to write a book. So I've written a book that really covers all the bases of learning what scoliosis is. When you're first diagnosed, you don't know what to do. What doctor should I see? What brace should I get? Is there a nutritional aspect? Is this hereditary? How should I take the x-rays? Should I get an MRI? Should I consider surgery? There are so many issues to be considered and decisions to make that you need a guide. You need a coach. Please visit Amazon to check out the Scoliosis Coach Handbook. So what should you do if you think you have scoliosis, or you've just learned that you have scoliosis, or you are worried about your child with scoliosis? The first thing is to follow some guidelines in my book about how to sort of assess your child from the front, from the side, from the back, and sort of look at those alignment issues. And then the next step for you would be to take yourself or your child to a pediatrician, to your regular doctor, and get them assessed. Early detection is very important. It doesn't matter what age you are. Early detection is important to prevent the curve from worsening either rapidly, slowly, at all. We want to halt the process of the curve worsening. So getting an x-ray is the first order of business, and you want to find out where should you take the x-ray, how should you take an x-ray. People are worried about radiation. There are options out there for different types of x-rays and different types of scans. So talk to your doctor about these issues. I outline all of these items in my Scoliosis Coach Handbook, and get assessed properly with a physician. If a scoliosis is left untreated, undiagnosed, in an adult, it can unfortunately progress up to a degree a year, which is a little alarming. If you think about, a span of 5 to 10 years, that could be quite a significant change in a curve that could really impact your life. So as an adult, you want to start to get proactive. But for children, it's a much more concerning situation. They're growing, they're having hormonal surges, they're having growth spurts, and they're active, they're sedentary. We can really lose track of the curves very quickly, and they can progress quite rapidly. There are short periods of time in their lives where it can really go crazy, like in pre-puberty. So it's very important to get assessed and diagnosed and start working with a treatment plan for scoliosis with the child very quickly. There's a lot of conversation about watching and waiting when a child is first diagnosed. It's my personal opinion that you should ignore that advice and get activated ASAP so that you don't lose some valuable treatment time. In each episode, we're going to dispel a myth or a common misconception with scoliosis, and we're going to crack the code. Our episode today, we're going to talk about the common misconception that only children get scoliosis. This is not true. You can acquire scoliosis as an adult, or you might have had a small scoliosis as a child that was undiagnosed that has been progressing over time. Let's get into it. It's often believed that scoliosis is a childhood and a children's issue, which of course it certainly is very common, but it can also arise in a newborn as a congenital issue. And a child is basically born with scoliosis and a condition that can cause scoliosis, or a scoliosis can show up at an early age as an idiopathic scoliosis, which means we don't know what caused it. And that can go undiagnosed, which is very important to monitor your children, especially if you have scoliosis in your family. It does tend to be a hereditary condition, but it can absolutely show up in adults. You can have an adult onset of scoliosis that can happen because of an arthritic situation or an injury. So it's important that you understand it can happen at any age. One common misconception is that scoliosis happens only in children and that it's a childhood issue, which is certainly very common in children, but it can actually be a situation where a child is born with scoliosis as a congenital issue, which means they're literally born with it as a condition that might have caused it. And there are multiple conditions that can cause that, but it can show up later in childhood, more in a preteen age, even as a youngster. So assessing your child early is important just to get a good screening. And this should happen with your pediatric doctor. Some schools perform these screenings, so it's important to ask. You can even just ask your school nurse. These conditions they can worsen rapidly, so getting early diagnosis and early care is super important, but it can absolutely happen in adults. It can show up later in life. Maybe we had scoliosis all along as a child and never noticed it, and it's been slowly progressing, or it's reached a critical point where it's causing you some pain, or it can show up as a result from an injury or from arthritis or a compression fracture. So scoliosis can happen at any age. So that does it for today. I'm so glad you're on this journey with me. I'm so passionate about scoliosis as a scoli survivor and having met so many amazing people along the way that have gotten such great results with very simple techniques that are accessible to anybody. I really hope you check out my book to learn about all the details that happen when you have scoli or your child is just newly diagnosed. There's so many questions and so many answers that we cover for you. So please reach out to me with any questions or comments that you may have. You can purchase my book in the show notes with the link to Amazon, and you can contact me at scoliosiscoach.com. I'm your scoliosis coach, Dr. Andromeda Stevens, and I look forward to seeing you on the next episode.